Hey everyone, Dr. Steve here. Hope you guys are doing well. Thank you so much for tuning in. In today's video, I'm going to be working on a live patient. It's a real last minute impromptu type video. I asked the patient if it's okay if we film this, because what we're filming is something that happens to all of us in dentistry not every single day, but at least once a month or maybe once a year. If this hasn't happened to you, it will happen to you. This is a great patient, super nice guy, and he came to me, he was actually referred to me down in Santa Barbara, and his recommended treatment down there was to actually do 4 root canals in the front, a severely worn teeth, almost to the gum line, and I felt like it was not the best situation for him because he would have just snapped those teeth off. His bite was super over collapsed, but he had really good canines. He had, I think, 1 or 2 good bicuspids and a good molar in the back, and then he had lower 8 to 10 teeth down below. And he only had so much money to spend. So I said, you know, we can actually probably do fixed bridges in these areas, save you a little bit of money. I think you'll be happy with it. But because your bite is so collapsed, let's try to open the bite. I explained that to him, what that means. And I had my lab involved, and I had my lab go ahead and fabricate 3 separate temporary bridges. And we opened the bite about 4 millimeters to make sure that he can actually talk normally, chew normally, make sure that his muscles were okay with that. We kept them in those bridges for about 8 weeks, and so it worked out really well. And then we went ahead and we cemented the Zirconia bridges. They're absolutely beautiful. He loves them. And then, of course, what happens? He's chips number 11 right here, right at the incisal edge. And this is why I'm explaining this to you, because you can actually see me repair this. Because his actually chief complaint with it was like, not the way it looked. I probably could have just smoothed it for him, but he was more concerned like, oh my gosh, am I gonna get another infection? He was super concerned about the infection because he's had one before. I said, oh my gosh, absolutely no way. Your tooth is very good, the nerve's good, everything looks great. But I could totally repair this. And so you gotta have confidence when you're going in there, because this is something that can be repaired. You don't have to redo the bridge, because that would cost you a lot of time, money, lab expense. And there are some materials out there that work extremely well, repairing porcelain, repairing zirconia. And these are materials that have been around for years. And so there's a material that I use, and you'll see this in the video, but I want to show you real quick right here because I get a better shot of it. It's called C&B Metabond. My father actually introduced me to this back in the 90s when we used to do some crazy bonding to large silver fillings, which I can't even believe we did that. But this stuff works really well. And what you do, I'll just show you real quickly, you'll see it in the video as well, is don't get overwhelmed with all these instructions. It's a real simple thing to do. Where he broke the actual incisal edge of the zirconia, I roughened that up just slightly with my diamond, and then I used this porcelain etch, which all you guys know about porcelain etch, and I put it on there for about 2 minutes and let it sit there. And then we rinsed that off. We got really frosty. It looks great. And then I went ahead, and this is what you do. You take this Metabond. It's called C&B Metabond. It's the quick base. 4 drops of this to 2 drops of this catalyst. You take this out here. If I can get it out. I don't need to get it out. But and you just turn this little knob here, and you get slow drops coming out. You get 2 drops of this to 4 drops here. I actually put an extra drop in here because it sets it up quicker, and I've used this a few times. But you might want to start with just the 2. And then I put a scoop to 2 scoops of powder in there, and I make it more of a real kind of runny, almost sour cream consistency, and I just paint a little bit right on the incisal edge, and it gets a little sticky. And then I could put composite, A2 packable composite, and I will use the actual base here to dip my instrument to keep it wet and kind of pack it, shape it, and then cure it. And it is rock solid when it goes on there. And then I obviously contour it. You'll see in the video too, what he didn't like when I finished it was that he felt like it was too long. And he was right. If I kept it that length, when we went to incisal extrusion, he would have chipped it. So we reduced it, repolished it really quick. It's about a 15 to 19 minute procedure, but it's one of those things that worked out extremely well. The other thing you can use for this was just happened to me yesterday. I was so mad I didn't film this. I had another patient come in, an individual who just doesn't have the means to redo her whole mouth, and she's just like trying to hang in there with like this bridge that some other dentist did, and it broke up the gum line, and she probably shouldn't have even done. And she comes in with this broken bridge and literally like just 2 teeth, there's nothing really to hang on to. And the other part of the enamel is actually in the bridge. So I did the same thing. I said, let's go ahead. And this was a little different procedure because she had actual tooth structure. And this is when you use the dentin, and you use this called the dentin activator. You put a drop of each of these in there, and you put it on the dentin on the roots there where she broke it. let it sit there for about 10 seconds. I did about 30 seconds because the teeth are completely almost like calcified, so there's really no sensitivity. And then I went ahead and I used this on the inside of the bridge. And again, 4 drops of this, 2 drops of that. I put 2 to 3 powders in. I made a little bit thicker consistency, put it on there. And I'm telling you, this thing is rock solid. I don't think it's going to go anywhere for a while. But it's one of those ways that you could help a patient. They're super thrilled. It's inexpensive. They think you're a fantastic dentist because you know what you're doing, and you're able to repair them, get their smile back. And it's a great way to build your practice as well. So hope you guys enjoyed the video. This was just a little quick intro. Thank you so much for tuning in. If you have any questions, please feel free to reach out or give us a call. Have a great day, and more videos will be coming your way. Take care. Thank you. Bye-bye. All right, everybody. Hey, this is Dr. Steve. Good to see you guys again. This is Taurino. Thank you for coming in. This was a very unique case that I did a couple months ago. He was referred to me by an office down in Santa Barbara. They were going to originally do a couple root canals and posts and crowns on teeth 7, 8, 9, and 10, but they were severely worn down, almost to the gum line. His bite was collapsed. And I just thought, oh my gosh, if they do heroics like that, he's going to break them off, just because there's just no way that was going to work. So what we talked about is having those front teeth out, and then opening up his bite a little bit by making some bridges for him, utilizing the teeth that he had. And so I worked with my lab. They made me a beautiful acrylic bridge, very strong, that I was able to open up his vertical dimension, and he was able to utilize that bridge for about 4 to 6 weeks to make sure he could tolerate it, maybe 2 months. And everything worked out beautifully. We put the new bridges in. He loves them. They look fantastic. They fit well. But then he just got this tiny little chip, and this is what happened. So I just put some porcelain etch on here. I'm going to rinse this off right now, and I'm going to show you a technique. Okay, abre la boca, Torino. Gracias. I'm going to show you a technique that we can do, versus replacing the bridge, and versus just alter. You can see how it's got this jagged edge right here. So we're going to rinse this off right now. Go ahead and turn on this section. A little bit of water. Un poquito de agua. Let's see how that porcelain is. That's been sitting there now for about 2 minutes. And you can see that nice frost right there. And then I'm going to use a material. Okay, we tell this. Manteiga, yeah, see. Gracias. I want to make sure that stays very dry. You could give them a small section occasionally. So, Kylie, if you can come around this way, watch your head there. And I'm going to use a material called C&B Metabond. And this is a material I've used for probably 25 years. And it's just fantastic for doing these type of repairs. It's old school. I mean, we used to use this back in the 90s. And so what I do is I place a couple of drops, 4 drops of the C&B. It's a quick base. I put this in here. We're going to go 1, 2, 3, 4. Let me do that one more time here. 1, 2, 3, 4. There we go. We can make cotton roll. I'm just going to soak up the other one here. This here. Okay, perfect. Okay, then this is the catalyst, and so I'm going to go ahead, take this off. You just kind of screw this like this, and then eventually some of this stuff is going to come out. So Kylie, I don't know if you can see this here, but we're going to go 4 drops of the quick base to 2 drops of this catalyst. It'll set up quicker. And I'm going to go 1 more. And if you really, this stuff is pretty potent. I mean, it can get you high. Let me just do a teeny bit more because I like to work fast. It sets up quicker for me. But 4 to 2 is good. You just want to be careful there. I can handle 3 because I've used this material a lot. And I'm going to mix this really good, and I'm going to go right here on the tooth here. I'm going to paint this on, just kind of let it dry there. And then what I'm going to do is, and this works well if you're actually trying to cement on a broken bridge or something like that. I'm going to use, does it have the, oh, here we go. I'm going to mix a little powder in here. And we're just going to put a little bit on the tooth. Let's see how that goes here. I'm going to mix this. Still a little bit wet. I'm going to add a little bit more. I'm going to mix this again. Perfect. So with this powder in here, it's going to mix really fast. And I'm going to take this 2x2, just wipe it. And I just want a little bit here. And this is what you would use if you were actually cementing a bridge on, but I have just a teeny bit here to give you a little extra. And I let it kind of sit there. You can take that now, I'm done with that. And then I just kind of let that sit. It's going to get a little sticky there. And it's crazy. Then I'm going to actually place some composite on top of it in just a couple of seconds here. And then we'll cure. And then it'll be actually all on there. And then I'll come back and I'll adjust and polish it. But this works really well for these type of procedures. If you just do normal bonding and etch and bond and flowable, it'll fall right off. So we'll go ahead, I'll take the no light. I'm gonna use the packable. We're going to use an A1 packable. That's what we chose at the beginning. And then I'm going to use. Take this real quick. I'm going to use. Will you give me a new brush? I'm going to get a fresh batch here. Just maybe two drops of this quick base. That's totally fine. Yeah. And then I'm going to put a drop. This stuff is so potent, I think it's getting this high. So, and then I'm going to do one drop of this quick base here. And I can use this kind of to wet my composite and bond everything in. And I'm telling you, this is kind of a Steve Johnson modified technique, but this works like a champ. I'll take the composite now. And I'm going to turn my light down there. See how this flows right on. So that composite acts, or the material there will act just like, it will bond right to the, right to the zirconia. And it's going right in there. Whenever I do something like this, I always overfill it, and it's a little bit sticky, but it's real nice. And then let's wet this again. Go right on there. Okay, then I'm going to take my mirror here. We're going to go like this. Okay, I'll take. Do you have a condenser? Actually, this works pretty good here. It's crazy. This was just like a tiny little sliver corner, but it's enough to drive the patient nuts and to make this tongue like keep going there, but it needed to be fixed. If I were just to polish and adjust, I could make it look pretty good, but then it would look shorter than that one there. So look, I'm just blend this here, and then I'm gonna cure this, and I'll take a little flowable. There we go. We're gonna cure that for about 10 seconds, and then I'll do a final cure. Perfect. And then there's this one here. A little bit of flowable. And we're going to go just like this. See how beautiful this works? Just a little bit over the... I used the flowable a little bit over the packable. And then I'll cure this. Okay, I'll take the micro brush again. I'm going to use the micro brush, dip it back into this mixture I made. And it's a little bulbous sticking out here, but I'm going to cut this back in for him, reshape it, contour it, and it'll be off to the races here. You're doing it. ¿Estás bien, Torino? ¿Todo está bien? Sí? Sí, qué bueno. Gracias. Okay. So so it's hard as a rock. It's bonded on there so well. So I'm actually going to just go over this right now. It's just, you know, this is kind of fun stuff to do, especially if you use this material. I'm just going to adjust this, polish it, and then do we have discs or? Oh yeah, perfect. See, Cassandra's always on top of her game. Okay, so she's got the disc for me. Turn my light back on here. I'm just shaping this composite, just like that. And then let's do that again. Actually, I'm gonna put a little water on here. Okay, poquito de agua, okay? I use a fine diamond here, polishing diamond, to just kind of do this. Because if you use a carbide composite burr, you would actually stain up the zirconia, so we don't want to do that. That'd be a bummer. I'm going to use these discs here, these soft flex discs. I'm going to reshape this a little bit. Okay, I'll take paper. See how light that just bonds in there beautifully. It's like the greatest little product I don't think many people know about. I mean, my dad turned me back on that in 1995, many years ago, and we used to actually bond silver fillings to teeth when they were big. I'm thinking, oh my gosh, you bond silver filling teeth, but we did it back then because it bonds well to silver, bonds well to composite, bonds well to porcelain, all that stuff. We're gonna, yeah, I'll take that. Okay, so we're just gonna check the bite. Okay, Torino, cierre la boca y abra. So I want to check that because I want to see exactly where he's hitting, so he doesn't break that piece again. So cierre la boca y abra. Okay, so he's hitting this tooth right here. Otra vez cierre y abra. Let me see that paper. Y, okay, otra vez cierre y abra. Okay, so yo voy speaking Spanish to camera now. I'm going to adjust slightly. ¿Está bien si yo puedo ajustar ese diente un poquito abajo? Okay, está bien, perfecto. So I'm going to adjust the bottom tooth just very slightly so I can keep that length there, right here. He's not going to feel this. This is ever so slightly here. And I'm going to do just a slight adjustment on the top with another polishing. This is the little polishing egg. I use a red diamond here, a red stripe polishing diamond. It's shaped like a football. It's remarkable how this just blends in so nice and blown away. And I haven't done this for a while. I just figured this is like the best thing to do. I used to do this all the time many years ago. I'm going to smooth this one up here for him. Okay, I want to check that bite again. And bite down again. Tap, tap, tap. Cierre. Y abra. Okay, un poquito más. ¿Cómo se siente cuando cierre? ¿Estás pegando o primero o no? ¿Todo se siente normal? Okay, okay, sí. Okay, yo voy I'm going to do a little more polish now, okay? And then I'll have Kylie get real close to the tooth here so you can see how it looks. And it's all better. So you can get up here closer, Kylie. So come around. If you want to come around this way, Kylie, maybe you come over right there. Can you get a good shot of that tooth? Mm-hmm. See how nice this looks, you guys? Nice repair. Again, if you were seriously ready to use a normal phosphoric acid etch And just normal bonding, there's no way it would not stay. But it looks as good as new. I'm going to go to the next thing. We're going to do this. And I always have my assistant, thank you, Cassandra. She puts a little air and water on there, keep it nice and wet and cool. It just does a really nice polish. We'll get the small one there. ¿Y cómo se siente con su mordida y también con su lengua? I'm asking, like, how does it feel to your bite into the tongue? Make sure there's no rough edges. Does it feel smooth?
Yeah.
Okay. Okay, I'm going to show him. He doesn't even know what it looks like. I'm going to show him with the mirror. Vamos a chequear, okay? Okay. Oh, let's take these off because we'll take the glass off because everything's going to look really good with these on. So, ¿se siente mejor? ¿O se parece mejor? Does he want me to? Do you want me to adjust it? Un poquito más, a little shorter.
Un poquito más corto. Sí, como más corto, así, nomás este chiquito.
Sí, claro que sí. Yo puedo hacer eso. Muy fácil. So I left it a little long for him. No big deal. This is easy. I can just cut it down a little bit and make it look a little bit better for him. Okay. So we're gonna do that right now.
No se siente filoso ni nada. Poquito sí, ahorita.
I made it too sharp so he could like really bite into his anything really strong, like a canine does. So I'm just going to shorten up just a tad. I'm going to tuck it in a little bit more. See, it just cuts just beautifully. And a little bit more on the inside. Still a little probably sharp right here on the inside. Oh, I don't want that burr. Where's my round one here? Where is my round one? There we go. See, this is, everyday dentistry. Trying to make it work and work for the patients. I'll soften that up for him now a little bit. Let's soften this up a little bit so it's not so sharp. Put a little air and water on that now. ¿Se siente mejor con su lengua?
Sí.
Sí, sí. Okay, and it's going to feel better. Yo voy a hacer un poquito más, okay? So it feels better.
Okay.
Yeah, so he's saying it feels a lot better. It felt a little sharp to him, a little bit long, so which is great. I'd rather have it shorter because it'll be less likely for him to break that edge again. So again, you just want to double check everything, make sure the patient's happy with it, and then happy patient, happy life, man. Then it's a home run, and take good care of them. ¿Se siente un poquito mejor? Sí, sí. Okay, and una más, so it's going to be mejor. Just like that. Beautiful. So I hope this is helpful for you guys. I mean, again, this is called, it's C&B Metabond, I believe is what it's, yeah, C&B Metabond. It's amazing. That stuff's been around forever. But it's so great to do these repairs. And you just have I have amazing success with it. ¿Cómo se siente, amigo? Con su mordida y lengua y todo.
Muy bien, ya.
Muy bien, ok, perfecto.
Igual como antes. Sí, ya.
¿Te gusta? Okay, bien. So that's it, guys. That's it. That's how you do a repair. It took maybe, I don't know, 15 minutes to do that. Appreciate you tuning in. If you have any questions, feel free to reach out to me. So thank you so much. I appreciate you guys. Thank you, Tarino. Muchas gracias. Okay, amigo. Okay, bien.